The Delta variant is as you know, a COVID-19 virus that was first isolated in India back in October, as I recall, of 2020. Subsequently, it spread throughout the world, and now in a lot of places, it's a predominant strain. In the United Kingdom, I think it causes almost 99% of infections. In the United States now, well over 80% of new COVID infections are the Delta strain. Anytime there's a new strain out, for me, there are three important things to look at with regard to that virus. One is, does it spread easier between people? Secondly, is it more virulent, or does it cause more severe disease? And lastly, does it have immune escapability, or can it reinfect people who have been infected with a different strain, or can it infect people who have been vaccinated? And so those are three important things to look at. And I think initially with this virus, the most outstanding feature, or the most scary feature, is that it tends to spread easier between people. In infectious diseases, we look at the spread of germs between people by a factor called the R0. Now, the original COVID strain had an R0 of 2, and what that means is that in an unvaccinated population, for any person who has the disease, they're likely to give it to 2 others, and then those people who get it are likely to give it to 2 others. So the original COVID had an R0 of 2. The Gamma strain has an R0 of 6 to 8. So for every one person that's infected in a non-immune population, they'll spread it to 6 to 8 others. So it spreads much more rapidly. The reason for this isn't 100% clear, although there was a recent Chinese study that showed that the Delta virus has a viral load of 1,000 times greater than the original virus. So there's a lot more virus in people who are infected. Another question, are there different symptoms associated with the Delta variant? It's similar, but the Delta variant, at least at this point, tends to cause more cold symptoms like headache, stuffy nose, sore throat. There appears to be less cough with it, and the loss of smell doesn't seem to be as big of an issue with this Delta variant either. The next question is, what do we know about hospitalization rates for COVID among vaccinated versus unvaccinated? The last I saw, I think, was July 22nd. At that point, 97% of hospitalized patients were unvaccinated, and only 3% were vaccinated. So the vast majority of people getting sick enough to be admitted to the hospital are unvaccinated. The next question here is, what do we know about breakthrough infections? And this has been studied somewhat with regard, and that would be breaking through the vaccines. And this has been studied with regard to the Pfizer vaccine, an mRNA vaccine, and the Moderna vaccine. And there's less data with the Johnson & Johnson, the J&J vaccine, but I think the best study looking at the Pfizer vaccine was published in the New England Journal a couple weeks ago. And what they showed is that 88% of people who got the Pfizer vaccine, in 88% of those people, the vaccine prevented symptomatic infection. There have been several studies looking at Moderna, including that study, and they show anywhere from about 70% protection to in the 90s protection against symptomatic infection. The J&J vaccine has been a lot less studied, but from what I've seen, it's about 70% protective against symptomatic infection. Now, from what we're seeing, the people who have been vaccinated and get infected tend to be much less severely ill. So that the people who are getting sick and being hospitalized and dying predominantly are unvaccinated. Okay, next question. What is concerning for the future? Are we worried about stronger variants? And this is very concerning to me. We're talking about Delta virus today, but in 3 or 4 months, we could be talking about something else and something even scarier. What concerns me now is when you look at the United States population, about half the population is fully vaccinated and the other half is not. The virus is flourishing and replicating in the unvaccinated population. That's how it's spreading. Now, RNA viruses like the COVID virus, as opposed to DNA viruses like hepatitis B virus, RNA viruses, when they replicate, they don't proofread their RNA, so they make mistakes all of the time. And most of the time when the virus replicates and it makes a mistake, it makes the virus non-viable, so the virus can't survive. But every once in a while, it'll have a mistake that's beneficial to the virus. And so the more virus there is out there, the more likely there is to be a beneficial mistake that makes the virus more infectious or more severe, that sort of thing. What concerns me now is that we have this pool of unvaccinated people in this country where the virus is flourishing and we're having all sorts of mutations. Now, if we have a mutation in that population that makes the virus resistant to the vaccines, well, still in that population of unvaccinated people, it has to compete against all the other viruses because unvaccinated people can get any of the viruses, you know, the alpha, the beta, the gamma, the delta, now the lambda, the iota, there's a bunch of them, kappa. They can get any of those. So this new mutated virus that's vaccine resistant would have to compete against then those other viruses, and it probably wouldn't predominate. However, if that mutant crosses over into the vaccinated population, they're not getting infected with alpha or beta or gamma or very much with the delta strain. So in the vaccinated population, that new mutant can flourish and reproduce and become predominant in that population. We can get a vaccine resistant mutant. And that's what concerns me right now. And that's why really we need to get the majority of the population vaccinated before we run into that problem. Then there already are other variants out there like the Lambda variant in Peru that are very concerning to me, at least. And then the last is, what is your recommendation for protecting yourself against the Delta variant? Vaccine would be one. Number two is mask, and I think it's most important to do that when you're in a crowded circumstance where you're not certain of the vaccination status of other people, like on public transit, the grocery store, that sort of thing. Some people will argue, and there have been arguments made, that masks don't protect the wearer. And there was a big study in Denmark recently called the DanMask study, where they had 6,000 people, and in 3,000, they sent a bunch of masks, and in the other 3,000, they had them go about their business without masks. Then they measured how many people got COVID, and in the people who didn't wear masks, 2.1% got COVID. People who did wear masks, 1.8% got COVID, and that wasn't statistically significant, the difference. And so people will argue, well, wearing a mask doesn't make a difference. Look at the DanMask study. But when they went back retrospectively and questioned the people who had been involved in the study, they polled those who were given masks and supposed to wear masks, and half of those people who were given masks admitted that they didn't wear the masks or wore them improperly. Half admitted it, and I wonder how many didn't. So it was a really poor study. It wasn't powered enough to find statistical significance, and I don't think it's valid. There's data out of China and Taiwan that suggests that masks are protective for the wearer. Additionally, there was a nice study, and I'll end with this. I know I'm being long-winded, but there's an aircraft carrier, the USS Roosevelt. On that, in March of 2020, there was a COVID-19 outbreak. So you had 5,000 sailors locked on that aircraft carrier, and about a quarter of them, about 1,200, came down with COVID. Now, the CDC went in and studied that, and they found that the sailors who wore masks were significantly less likely to acquire COVID than those who didn't. So, I think that's reasonable evidence to support the wearing of masks, and I'll stop with that.
Henry, this one is for you, and it has to do with studies, and there's been ongoing questions regarding mRNA technology, and is it safe in humans? Has it been previously used in humans? And if possibly there's some articles or info we could get from you, maybe to post in connections of those of the studies on that. Thoughts about that?
Well, mRNA vaccines aren't terribly new. They've been studied in animals in the past, but of course, as everyone here knows, the first two licensed for human use have been the Moderna and the Pfizer vaccine. There are questions about certain adverse effects, and the big ones, I think, to date with the mRNA vaccines has been heart muscle inflammation or myocarditis. there have been several studies looking at that, and the risk of heart muscle inflammation from the COVID virus, natural infection, is many times greater than the risk from the vaccine. The vaccine risk is minuscule. The J&J and the AstraZeneca vaccines had been associated with a low incidence of blood clots, certainly a very low incidence, less than that is seen with oral contraceptives, for instance. So, they haven't been around and used in humans for a long time. They have been studied in animals with different types of vaccines in different mammals for years now. But I think all of the data thus far suggests that they are safe, and that certainly the benefit outweighs the risk.
Is there a vaccine, Dr. Arguinchona, that is being developed to target the Delta variant?
That's being considered, particularly by Pfizer and Moderna. It's easier to change the vaccine. It would be easier for Pfizer and Moderna just to alter their mRNA, to change the spike protein that's generated. It's being considered. The thing that concerns me with regard to that is that we are talking about Delta today, but in 3 or 4 months, we could be talking about Lambda or something else. And I think, those things are important, but the most important thing is getting the vast majority of people vaccinated to prevent replication and the generation of new variants.
Yeah, agree. Can vaccinated people, Dr. Arguinchona, also spread the virus?
With the Delta strain, we know that vaccinated people can get the virus. They get it, they are protected, but there are breakthrough infections, as we discussed earlier. And how contagious are vaccinated people when they get infected? I don't think anybody knows yet. I would presume that they can, in fact, spread infection. And that's why, when I'm in the hospital, when I'm at a grocery store or anywhere in public, I wear a mask, and it's not so much to protect myself, but, I'm around infected people all the time. And if I had an asymptomatic infection, I certainly wouldn't want to give to anybody else, particularly anyone who's sick. But I think at this point, we have to presume that vaccinated people who get infected can spread the virus.
Okay, thank you. Pfizer's been talking about the development or a recommendation on the booster. What do you know about that?
Well, I know that Pfizer a week or two ago put out some data, and what they showed is that when they gave a booster or a third dose of their standard vaccine, that antibodies to the Delta variant were increased multiple times. Now, this is just data from Pfizer, and I haven't seen that corroborated in any other study, but it was fairly impressive data. I think it needs to be corroborated in other studies. Certainly, Pfizer has an interest in giving a third shot, but initially it looks like it may be beneficial. In Israel now, in their over 60s population, they are giving a third shot based on that data. And in Israel, the Pfizer vaccine was what was used. So could be beneficial. I'm waiting further data.
Okay, thank you. Dr. Arguinchona, these kind of go together. It has to do with vaccine confidence. And there's one person here that said they've heard getting the vaccine's actually worse for you compared to getting COVID-19. And then along with that goes, how can healthcare workers have confidence in vaccinations when restrictions are now being reinstituted even for vaccinated persons?
Well, I think the data is clear that the risk of infection is much greater than the risk from the vaccine. The risk of death is astronomically higher from the innate infection than the vaccine. And it's even been looked at in all sorts of different patient populations, even in pregnant women. There was a very big study in the New England Journal that looked at the incidence of adverse effects in pregnant women. I think they looked at 16,000 people who were vaccinated with mRNA vaccines, and they found no increased incidence of adverse effects. However, a study in the Lancet from England published looking at COVID-19 infection in pregnant women showed that they had increased risk of going to ICU, being on ventilator, increased risk of death, increased risk of premature labor, and the baby going to the neonatal ICU. So in almost every population of patients that's been studied, the natural infection is much riskier than is the vaccine. I don't think it's close. And was there another part to that question?
Well, I think, let me find my list here again. How can healthcare workers have confidence in the vaccinations when restrictions are now being reinstituted even for vaccinated persons?
Well, still, in this country, the epidemic is being propagated by the unvaccinated population. Now, can vaccinated people get it? Well, yes, they can, but the incidence is much, much lower in vaccinated people than non-vaccinated people. So really what's driving this epidemic and what's driving the Delta epidemic is the unvaccinated population. So, I think anything you do in medicine, there's some risk. Any vaccine, any medicine, if I write someone for penicillin, there's a risk there. And you have to weigh risk benefit. And I think in this circumstance, looking at all the data, and I wasn't necessarily a believer initially, but after looking at all of the data, I think the benefit of the vaccine greatly outweighs the risk, and that this epidemic in our country is being driven by the 50% of people who are not fully vaccinated.
That is the end of our questions for today. I want to thank all of our presenters. And, Henry, I think I'm going to let you make a closing statement to the group here that's watching today.
Okay. I don't want to get too preachy here, but I think when I look at this epidemic, and the vaccine, I think I may have given a personal story before, but my daughter just gave birth a few weeks ago. But early on, she called me up and said, "Dad, should I get the COVID vaccine?" when she was about, 8 weeks pregnant. And I said, "Hey, let's wait on that. There's not enough data yet." So I didn't, jump on board with this initially, but waited, to see the data. And as the data came back regarding pregnant women being at high risk from infection and the vaccine being safe, ultimately I said, "Yeah, Olivia, you need to be vaccinated. We need to do that." And she got vaccinated. And so, I don't think the physicians here are taking the vaccine lightly, or people are just jumping in without thinking, without worrying about it. And I'm one of those doctors who was skeptical initially, but I do think it's the best thing. Lastly, the point I want to make is that when you're vaccinated, you're doing it for yourself, but really you're doing it for everybody else. As a healthcare worker, I would have a hard time walking around the hospital, taking care of sick people, not being vaccinated, knowing that I could spread infection to these compromised people and cause morbidity and mortality among them. And that's the main reason I wear a mask when I'm at the grocery store now, or when I'm around a bunch of people, is I don't want to spread it to other people. And so it's important to get vaccinated to protect yourself, but almost more important is to protect those around you.